This exercise will the Zimmer Biomet implant removal kit with improved features. The top compartment will show the implant remover. Then we have the implant removal screws, and this is a new feature. It's all color-coded. And we look in here, we have the screwdriver, again, short, medium, and long. It depends on the inter-arch space. The wrench, because it's two-piece, easy for sterilization. You take the component off the actual wrench in here, and the way you put it together, it just simply screws in there. For the exercise here, we have an implant that's showing some crustal bone loss because of peri-implantitis. So the first thing we have to decide is on the driver. So we try the 2.0. If it doesn't engage, then we have to go to the larger size. So if you look at this screw here, it's wobbly, so that's probably not the right one. So you put it back, and then the easiest thing is to go on to the next one. Once it's the right one, then you engage it to the screwdriver. Since it's a posterior implant, I'm going to use the short screwdriver. And the way this implant removal kit works, it's reverse engineering. So if we're going to tighten this screw, it's going to go clockwise. So as we tighten this screw, you will start feeling the resistance. And the recommended torque, as you see on the torque wrench, we want to torque that screw to about 60. So as you tighten it, now it's skipping when it gets to about 60. At this point, we disengage the wrench, the driver, and as far as the selection of the screws for the clinicians, Zimmer Biomet have a chart that you can download from the website, or it comes with the instruction when you do have the implant removal kit. So at this point, we will select the implant remover. The posterior, we will engage the short. It goes counterclock. So as we see in here, that seems to engage that brand implant very well. And the way we're going to remove this implant is we're going to go counterclockwise. So there's the arrow here, we have to switch that. And now on the other side of the driver, which is a new feature, that you can see the amount of torque you can apply on this implant to remove it. And it ranges between 100 to 400. So you can apply significant amount of torque on this implant. And really the key, sometimes clinicians fail to remove the implant because you're really not applying a vertical pressure on that driver. And now we're just going to go there slowly. And most of the times when this implant is osseointegrated, you kind of feel a little bit of pressure as it does disengage. You kind of feel it because now it's a little bit easier to remove. And sometimes if you do not really select the right implant remover, you need to stop because otherwise you'll damage the implant. It'll become very difficult to remove. So if you're not sure, take your time until you select the right driver. At this point, we have to disengage the implant remover. It could be used again in the future. You probably need to use the long screwdriver in this. And now you put the ratchet back in place, but now we have to put it in the position where it's going clockwise. And then the last part is to take the screw off from this implant removal, which is very easy. So at this point, if the site is inspected, cleaned, the granulation tissue is removed, we sometimes can do an immediate implant placement. And the placement of this implant, since we removed a 4.2 millimeter implant, I'm going right into the site and placing a trabecular metal implant that's a 4.7 by 13 millimeter. So the insertion of the TM is a little bit more technique sensitive because the midsection of the implant does not have the threads. So when we get to the TM section, we're pressing a little bit vertically. So once we pass that middle section, We're going to engage the coronal aspect of the TM. And now our insertion torque is getting to be quite high. This is over probably 50 Newton centimeter. And in this case, we will be placing the implant at crest or subcrestal. And the clinician have the option of placing a Bellatech Encode healing abutment, so the restoring dentist can scan the Encode abutment as early as 2 to 4 weeks, and the final restoration could be milled and delivered in a quick fashion.